Hello, good morning, scientists, and you're welcome back to the channel. It's always beautiful to have you here as we build our science community, get better at our science. Today, we're just talking about hepatitis. And what's hepatitis? Hepatitis is liver disease. Is liver disease where you have the inflammation of the liver through the fact that the liver has been infected by one virus or the other. And this leads to liver damage, could lead to liver cancer. It leads to a situation where the liver is not functioning very well, and by extension could also lead to jaundice, where you have the yellowing of the skin, you have the difficulty in the production of bile by the liver. And we know that bile is involved in digestion and absorption of nutrients within the human body. So these are some of the things, and the liver is involved in quite a number of activities within the human body: detoxification of different materials, alcohol, other things that we ingest into our body. The liver performs a lot of functions. Now, when it comes to hepatitis and the inflammation of the liver, there are about five types of hepatitis that we know. Have hepatitis A, B, C, D, and E, and they are all different, and they are all caused by viruses. So you have hepatitis A virus, B virus, C virus, D virus, and E virus. Now, it's important to know that hepatitis A and E are transmitted through the fecal oral route. So, meaning when we take in materials, food materials that have been contaminated with fecal matter. That's what we call the fecal oral. That's what we call transmission of infection and diseases and pathogens through the fecal oral route. So all of these routes play a role in the all of these routes play a role in the transmission of this disease. So you have hepatitis A and hepatitis E. Now you also have hepatitis B, C, and D. Hepatitis B is transmitted through sexual intercourse and through exchange of blood or body fluid, and this is important. You also have hepatitis C and hepatitis D that are transmitted through blood. So people who use different kinds of chemical substances, psychoanalytic substances like heroin, LSD, and the rest, and they exchange needles. They are in the risk of infecting themselves with all these diseases. So hepatitis is quite serious, and we need to take it really, really serious. There's also difference in the transmission routes, like I've told us, the different routes through which this disease can be transmitted. The disease also has, for the different types of hepatitis, you also have different incubation periods. And you know what the incubation period is? That's the period between when you have the entry of the pathogen into the human body, and then you have the actual display of signs and symptoms from that pathogen. So for each of these hepatitis, they have different incubation periods. Hepatitis A has an incubation period of between 15 to 50 days, hepatitis B 45 to 160 days, hepatitis C 2 to 2 weeks, and hepatitis E 2 to 8 weeks. So these are all the incubation periods for the different hepatitis. And then when we talk about the pathophysiology or the pathology of this disease, what exactly happens when any of these viruses finds its way into the human body? They have affinity, affection for the cells of the liver, which we call the hepatocytes. So these pathogens, they gravitate towards the liver, they flow in the bloodstream and find their way to the liver. When they get to the liver, they begin to infect these hepatocytes. They begin to find their way into the individual liver cells. And when they find their way into these liver cells, they could do quite a number of things. Number one, they begin to cause cell damage. First, there is the immune system which tries to fight against them, and then this immune system, as it's fighting against them, it's causing cell damage, is leaving different components within the cell and leading to cell damage. And over time, this can cause cirrhosis of the liver, hardening of the liver cell tissues and cells in such a way that they begin to lose their function. It can cause jaundice, and it can also cause liver cancer, the infection of the liver by all these viruses. And this is important for us to know. Symptoms that you see in people who are suffering from different kinds of hepatitis: you see fatigue, you see loss of appetite, you see jaundice. You could see abdominal pain, and these are some of you could also see dark urine and a loss of appetite. These are some of the symptoms that we do see in individuals who are suffering from liver damage. But of course, to be able to confirm if it's liver damage, there are quite a number of diagnostic tests that can be done, and this include liver function test. This includes you have liver function test, you have PCR to determine viruses, and you have many other tests like that. You have viral antigen detection test. These are all the different tests that can be done to determine for the presence of these viruses within the liver cells. This is very, very important. And then treatment, there are many ways to treat. Some of them are self-limiting. And when you say a virus is self-limiting, you're saying that that virus runs its course over a period of time. So, like common cold, the virus is self-limiting over a period of time. The virus will run its course and it will go. So, hepatitis A is self-limiting in nature. Hepatitis B, C, and D have antiviral medications that are administered for their care. So all this will be done by medical experts who have the ability and capability to do so. Vaccines also exist, and it's important to know that there are vaccines for hepatitis A and hepatitis B that can help provide protection against these illnesses. Thank you for listening to this video. Do have a wonderful day. Remember to like, subscribe to our channel, and we'll continue to build this science community. Have a wonderful day.